Okay, this is Drummer. He's a 22-year-old quarter horse gelding. Dr. White's going to float his teeth today. For those of you who don't know what that means, as a horse gets older and because of the motion they chew in, they get points on their teeth. They wear down. And so this process takes those points off. The reason we know Drummer needs his teeth floated is while he's eating, he's starting to slobber out a lot of his grain, starting to lose a little bit of weight. And on these older horses, you sure can't let them get down because it's too hard to get them back. Just like elderly people, once they get down, it's hard to get them back in good condition. So, and this, what he's doing now is putting a mouth jack in so the Drummer can't bite down on the equipment. Drummer's been tranquilized. You'll notice he's having a little trouble steadying himself. And the person holding him here is Tammy. And she's going to help Dr. White do this process. We're going to get in a little closer here in a minute if he'll let us look, so you can see what we're doing. Step in there and you can take the start points off. A float tool. Once again, you can see, now you can really see what the mouth jack does. It doesn't allow them to close their teeth down. The horse has a tremendous bite pressure. And it can really, really hurt your hand. So the mouth jack just holds his mouth open. The tool Dr. White is using is powered by an air compressor, so I'm sure you're hearing that. See how relaxed he is when we're not, see how relaxed he is when he's not working on him. And so he's just pretty well zoned out there, taking it easy. And we're going to trade sides to work on the other side.
Generally we do mouth exams. A lot of young horses, when we castrate them, we pop what they call our wolf teeth, which are kind of just like wisdom teeth in people. A lot of horses, some have them, some don't. They're at the very front though, in front of the premolars. A lot of those are popped at birth, and then first time we really do a lot of dental work can just depend on the horse and what its function is going to be. We do them generally, you can start them as early as 2 or 3 year olds. Between that 2 and 3 and 4 and 5 year old stage, they pop what we call our caps or baby teeth, retained, that they pop. After those is when they can get a lot of sharper points just from the eruption of those new teeth. And then after that, it's just based on kind of the need of the horse. Some people do it once a year, some people do it every other year. A lot of it just depends on how the horse wears. Horse's mouth wears side to side, so they get points on the upper outside and lower inside arcade. And then over time, as they get older, we look for problems such as waves or ramps, which we try to take down over time. Every now and then you'll have a tooth they'll lose a tooth on the top or bottom, and you may have to cut a molar to make them wear at least a little closer and keep that one tooth out of the gum line. And then those horses tend to need more care from a year-to-year basis on certain parts of their mouth, but each horse is different, and a lot of it's based on what their function is, on how often we do a lot of teeth work on them.
Does what they eat have any effect on their teeth?
Oh, it can to an extent, just from the grinding. And horses that are on, just like cattle, if they are on a sandier ground where they're eating there, the sand can do more wear to more so the incisors on the front.
Well, we'd like to thank you, Dr. White. I appreciate your time today.